RecoverWell makes it easy to find available treatment options that match your patient's needs, so you can get them discharged to life-saving treatment facilities fast. RecoverWell works for patients needing a higher level of care for primary addiction, mental health, and eating disorders. The platform can be accessed on your mobile phone, tablet, or computer. RecoverWell is password protected to keep information secure. To use RecoverWell, you must create a unique password and username. In order to create a user account, we will need your full name, workplace email, workplace address, and contact phone number. You can set your preferences to receive SMS or email notifications when you have updates about patient applications. SMS notifications do help expedite patient bookings, as you can receive alerts in real time while on the go. RecoverWell requires a HIPAA authorization to be filled out by every patient voluntarily seeking treatment options from RecoverWell. This is to protect you, the hospital, the patient, and of course, RecoverWell. There are 3 ways this authorization can be captured: by text confirmation, email confirmation, or by print and sign. The assessment collects information we will use to match your patients to facilities who can most accurately serve their needs. The goal of the assessment and match process is to eliminate any facilities that will reject your patient. Most, if not all, of the information required to match your patient would be found in your patient's chart. Our forms are multiple choice and choose all that apply options to make the process simple and fast. You will only need to fill out this application one time to apply to as many facilities as your patient would like. In order to match your patient, we need to know their name, date of birth and gender, their insurance type and member identification, history of substance use, mental health diagnosis, comorbidities, prescribed medications, accommodation requirements, and the level of care needed. Once this information is provided, we will list matched facilities in order of distance to you. You can be confident that the options listed for your patients are facilities that will accept your patient if they have availability. After you have reviewed the options and applied to the facilities your patient is most interested in, you can track the status of the application right on the platform. To check the status, click on View Application next to your patient's name on your Open Cases dashboard. Once opened, you will be able to see the contact information for the facility admissions person, including an email and phone number where you can call directly with any questions you may have. But you may also speak directly to them in the chat portal by clicking on Messages. We always recommend that you upload the H&P into the chat. This helps expedite the process and will fill in any unique patient details that the standardized RecoverWell assessment may have missed. The first status will be a verification of benefits. If the patient is a Medicaid patient, the facility will verify that the policy exists by clicking on Yes. If the patient does not have current Medicaid status, you can discuss with the treatment provider what would be needed to access emergency or provisional Medicaid. If the patient has private commercial insurance, the facility will also provide an estimate of the patient's out-of-pocket costs to admit to that facility. This estimate of benefits will include their unmet deductible, their copay, and any scholarship that the facility is willing to offer the patient for financial hardship. You can provide this summary total to your patient so they can decide which facility is the best for them personally and financially. Next, the facilities will request to interview your patient. To accept the request, go into your messages with that facility and let them know a time and contact number that is best to reach the patient. We recommend that you set up the time that is most convenient for you and the patient. Once the patient has spoken to the admissions team, the facility will confirm if they can accept the patient by clicking yes on patient meets criteria. You will receive a notification when your patient has been accepted. Once accepted, you can work with the treatment facility in chat or by phone to set up the transfer once the patient is ready for discharge. Once that happens, go ahead and click on Ready to Commit. This will alert the treatment facility that the patient is en route. It will also move this patient into booked status and off your open cases tab. You will then receive 2 more notifications regarding this patient. One, when they are admitted to the treatment facility, and the second, when they are being discharged from that facility. You'll be able to see the status of that patient's discharge to know if the patient successfully completed treatment at that facility. That's everything you need to know about creating a profile for your patient and applying them to multiple facilities. You may always reach out to us for additional help, and we look forward to working with you.